Hey guys, I hope everyone is well out there. So we've been hearing all sorts of things about billionaires, right? And a lot of them just seem to be sick people. And I was thinking about the healthcare industry and how corrupt it really is, that it isn't health at all, but maintaining illness and getting a lot of people rich while a lot of people get poor. So I started looking into, there's something like 50 billionaires have been made from the healthcare industry, and dozens of healthcare companies, insurance companies, making record profits annually. Now that's money that is coming out of people's pockets, right? That is siphoning upwards like everywhere else across the board in our economy. So I just decided to do some research. If that money, so you have those billionaires getting wealthier and wealthier, and you have people going bankrupt trying to pay their medical costs. So I looked into and I did some research. What if you did the opposite? Took all that money back and gave it back to the people. So let's take a little look here, and we'll talk more as we go. I'm just going to read a little. The scale of money flowing through the American healthcare system is staggering. U.S. healthcare spending is now over $5 trillion per year, about 18% of the U.S. economy. A significant amount of wealth has been created at the top of the system. Some context on CEO compensation and billionaire wealth in healthcare. CEOs of the largest health insurance companies regularly earn 20 to 60 million plus annually in compensation packages. Think if there wasn't this middleman. Think if there wasn't the middleman siphoning money off from everyone. The largest 7 publicly traded insurers alone generated over $70 billion in profits in recent years. A Yale study found that 92% of major healthcare corporations distributed $2.6 trillion to who? To shareholders from 2001 to 2022. On the other side of this is the medical debt. It is one of the leading contributors to personal bankruptcy in the United States. We have allowed greed to take over our beautiful country. And now there is a power play right now happening before our eyes. Millions of Americans delay or avoid healthcare because of cost. People stay in jobs they don't like. I know I've done that to keep insurance. Families postpone having children, starting businesses, moving, retiring, or pursuing education because they fear losing coverage or facing catastrophic bills. If money that was accumulated upward into billionaire wealth, shareholder payouts, and massive executive compensation instead flowed directly to ordinary Americans, what would that look like? Let's use $2.6 trillion to shareholders in over 21 years as an example. Spread across 330 million Americans, that equals $7,900 per person, or $31,000 for a family of 4. If you focus that money only on Americans carrying medical debt, that's $26,000 per person. That is enough to completely erase medical debt for most every family. And that's before considering executive compensation, admin overhead, stock buybacks, duplicated billing systems, private equity extraction, inflated pricing structures. The problem is way bigger than the 50 billionaires, but they're the glaring issue. The structure itself, it's the fragmented insurance system, the profit incentives, the hospitalization consolidation, the production line, the pharmaceutical gouging, the administrative complexity, and shareholder-driven growth expectations all compound the cost. But there's a human cost that people don't talk about. The entrepreneur who never took the risk. The artist who stayed in a corporate job that was killing their soul. The parent who delayed treatment, the bankruptcy, the couple afraid of bankruptcy, the chronic stress of knowing illness could financially destroy your family. The psychological burden that shapes lives before bankruptcy ever happens. At the same time, it's also true that healthcare is inherently expensive. Aging populations, advanced technology, expensive drugs, etc., etc. But many Americans look at the contrast, the enormous wealth, the greed, the overcharging for things. I had a procedure done a number of years ago. They charged $45 for gauze. Gauze, $45. It was insane. Now let's take the camera out a bit and look elsewhere. When people compare the U.S. healthcare system to universal systems in countries like Canada, the UK, Germany, Nordic countries, the biggest difference they point to is admin overhead and profit extraction. Admin overhead, profit extraction. That's the middleman. That's the thing. Universal healthcare, government is not trying to make money. Additionally, you have a conflict of interest, right? We're going to deny this claim from this technicality. What can we get away with? I mean, when I went to a specialist, my God, it was like this specialist, that specialist. Nobody wants to do anything, and they just charge you. The United States spends more on healthcare than any nation in human history. Over $5 trillion annually, roughly twice as much per person as many universal healthcare countries. Yet Americans often have worse outcomes on life expectancy, chronic illness, infant mortality, and medical debt. This is their leaders who have allowed this greed. Some of the largest healthcare and pharmaceutical corporations have made enormous profits in that system. United Health Group, tens of billions in annual profit. That's just profit. That means they're charging way more than they need to charge. CVS Health, Cigna Group, Elevance Health, Humana, Pfizer, Johnson & Johnson, Merck & Company, Eli Lilly and Company, AbbVie, and the list goes on. That's why part of critics complain that the structural design is to extract wealth upward. This is not health care. This is wealth care, their own wealth. Why are so many people, why is the middle class shrinking? This is a good reason. Let's talk about the Koch brothers. The Koch brothers a few years ago, and the Koch brothers are actually a libertarian-leaning group, very wealthy guys. They did a study on universal health care. And they found that the total national, this was the opposite of what they expected to find. So they wanted to find proof that universal health care is wrong, but they found the opposite. Total national health care spending could actually decline overall because of reduced, again, admin costs, profit margin, negotiated drug prices, and simplified billing. Even critics of universal health care were forced to acknowledge that the current system contains enormous inefficiencies. And here's the hidden part. Americans already pay massive healthcare taxes. They're just hidden. Premiums, deductibles, co-pays, surprise bills, employer deductions, denied claims, medical debt, and bankruptcy. In universal systems, the government becomes the primary negotiator and payer, which changes bargaining power dramatically. Excuse me. Canada spends far less per capita than the US. The UK spends dramatically less. Germany and France cover everyone while still spending substantially less overall. So the BS that we keep hearing is BS because they don't want the system to change. You got to watch who's telling you the BS, and you got to follow the money. None of those countries have widespread medical bankruptcy on the American scale. The U.S. also carries enormous admin complexity. Private insurers, prior authorizations, billing departments, coding systems, network negotiations, pharmacy benefit. How many people are on the teat of this? And we are the one paying. Collections, marketing, shareholders, executive compensation. You just eliminate the executive compensation alone, you're going to eliminate a lot of the debt and a lot of the expense. How much can they squeeze? How much do they need to squeeze? How much should we be allowing them to squeeze? You know, and then you hear prices for like insulin or ambulances, you know, it's $2,000 to go in, and it's insane. This was never the case. And if I understand it correctly, up until the 70s, health insurers were non-profit. They did not charge this kind of money. Non-profit. So this is where many Americans feel the deepest fracture. They see a society capable of producing extraordinary wealth and medical innovation, yet millions of people ration insulin, avoid ambulances, stay trapped in jobs for insurance, delay cancer screenings, or go bankrupt after illness. Cruelty, cruelty, cruelty. Just so those greedy bastards can keep taking money, extracting from people. So when people say the system feels morally upside down or corrupt or bankrupt, they're not only reacting to numbers, they're reacting to the experience of being vulnerable and being turned into a profit center. Your body has become a profit center for them. And it is heartbreaking to think of it this way, but it is true and glaring. The other thing about these countries, I'd like to say, is they're kind to each other. Do you think Canada is just kind because they live north? Canadians are nice to each other. Maybe because they take better care of each other. It's not it's not a dog-eat-dog world. You have healthcare, you have education. These are two of the biggest expenses. A friend of mine is going to send his child to University of Michigan, $82,000 a year. $82,000 a year. We have lost control. I don't know how else to say it. We have lost control. And if you look at our leadership now, it is quite evident we have lost control. Hopefully we can find it again and actually be the great shining country on the hill that we are capable of being. The great people the people that we are capable of being. Most of us have great compassion. But when you're getting squeezed, a lot of people don't feel as generous. They don't feel as nice. When you hear propaganda left and right talking about divisiveness and the lies that the other side is against you and everyone's evil, watch the money. Follow the money. Most people, it doesn't matter if you're right or left. It doesn't matter. You're people first before you become some ideology. We're getting fed this BS while we are getting pickpocketed left and right. This is the shrinking middle class. This is a shrinking America. I mean, the debt is trillions and trillions. It has gone up trillions of dollars in a year since Trump has taken over. He's not helping anybody but him and his friends. We are better than this. We are all much, much better than this. Have a great day.